Welcome to Between Two Pastries. This is Nicole.
Hey everyone, it's Annie.
Today we have a part two session of our mom's podcast. Really excited about this. So, lots of celebration. We had such a good session the first time that we did this, and we thought, okay, there's still more conversation to have. In fact, Annie and I sent a list to everybody of here are all the things we should talk about. So just minor things, by the way. They're big. Anyway, and congratulations to Emily because she did have her sweet baby, and that's what we were waiting for in order to do a part two. So anyway, so excited to hear about that experience for you because you were still with child as we were doing the first pod. So it's like you were kind of having that pre-experience and now it's the beginning of the post-experience. So um anyway, Emily, do you want to talk about that experience?
Yeah, well, yeah, and also like we had this podcast and like other people were talking about their post and we've got kids,
Yeah,
like everything,
right.
and you were kind of in the throes of it, and I was shortly before you, but not by much. What was your experience when it all came to fruition?
As far as bringing baby home or getting baby into the world.
Bringing baby
Getting
into the
baby into
world,
the
did you
world.
enjoy
That's what I
it?
want to talk about. Yeah.
And so
How was that?
so in true okay, so I've been calling him Turd since like I don't know, 18 weeks when I could start to really feel him and he partied all night and all day.
Wow.
Kicking, punching, hiccups constantly, like he was the most active. Even my doctor wrote on my like ultrasound stuff, very active baby. So I felt validated with that. So he put on a final show before he decided to arrive. I was induced
Okay.
on a Tuesday evening. My water actually broke in the wee hours of the morning on that Wednesday, and he did not arrive until 4:28 on Thursday morning.
Ooh.
It was
Oof.
a lot of, I thought I was tough. Like, I really thought that I
Oh,
was like a tough
Emily, I
human.
wanted to
And
jump out the window.
yeah.
out of
Like
my,
I was ready
I
to let
wanted
it
to
all
leave.
go.
I wanted to leave my
Yes,
body.
yes.
It was not fun.
Hands down.
I did hold off for like 14 hours before I was like, if somebody doesn't give me an epidural, like, we're all gonna die.
Oh my
I
gosh.
think I made it
To make
three.
to yeah, to make matters worse, he did his heart rate kept dropping if
Oh.
anytime I would move off of my right side. So to be on my
Mm.
back, to go on my left side, his heart rate would drop. I would have a room full of medical staff.
Jeez
So
Louise.
that was a lot of fun.
Mm,
Um, there was no sleeping, but the good part, I guess, was that there was no like it didn't feel that long to me. Everyone
Mm.
else
that's good.
thought it was taking forever, but for me, it was kind of like when I ran a 200 miler, and it was one long day of light and dark. So that's
See?
the closest thing that I can kind of
Yeah.
put it to. But after we started the C-section process, because he just
Oh.
wasn't coming. Anytime they'd increase pitocin, his heart rate would drop. Anytime I
Oh.
would move or look up or down, heart rate would
Uh,
drop. So finally, enough was enough, and we he was out in 45 minutes, and it was instant screaming, and it was the most beautiful sound I've ever heard, and I lost
oh.
it, and it felt like an eternity from the time that they like had him till I got him, but
Yeah.
it was worth it, and he's amazing. He's this
Oh.
amazing little human.
That's so cool.
Oh.
Congratulations, Emily. That's a rough
Yeah.
48 hours that you had there too. But it's worth,
Let me leave. They let me come home on Saturday morning, so that was kind of nice.
that's
But
nice.
then I was like, what am I supposed to do with this thing?
They don't
Yeah.
teach you
Isn't
about
that?
any of that.
What do I
Yeah.
do? What do I do?
What do I do? Just
Where's the
holding it
nurse
out
to
there.
take
Like, what?
him?
Well, and he was so good in the hospital. Like I never had the nurse come get him.
Oh,
Like
nice.
he was with us the whole time. And
That's
they're
good.
actually like, if you guys need some sleep, I'm like, he's sleeping. Like,
Yeah.
yeah. So, and then when we got home, he was, back to his turd self.
Yeah.
That's awesome.
That
It's
is
been game
super
on ever
awesome.
since, but how awesome. And he like changes every day. And I
Yeah.
can't, he'll be 6 weeks old tomorrow.
Oh, wow.
I can't believe it. Yeah.
Yeah, that's
And
crazy.
he's
So
like, he
cool.
was born with 7 pounds and he's got to be like 11. He's gaining weight so fast and just getting so
Yeah.
big. Or like
Yeah.
most babies are leaving the hospital, like when they've lost weight, you're already trending from the 2 ounces he lost.
Wow.
That's my boy.
Wow.
That's good. That's
Yeah.
good.
So,
That's
That
so
is
that's
really
been good.
cool.
Yeah,
good.
yeah.
Well,
He did have
and kind of,
he had a tongue tie, so we were having
oh,
latching issues, and we still have. So
Oh,
I never in my wildest dreams thought I would care about my boobs as much as I do nowadays. So
yeah.
so
Well,
are you, and speaking of that, are you feeding? How are you feeding and how's that going?
so I can't keep up with him. So I'm pumping and we're supplementing formula. So it's
Mhm.
oh my
probably
gosh.
we're close to 50-50. It's just like
Oh, okay.
I had he had the tongue tie fixed that Monday after he was born. So we had like 5 days and he just took off. So like I haven't been able to catch up
Yeah.
as much as I have tried, but I still feel good that, I'm giving him something.
Yeah.
Bringing everyone into the conversation too. Emily, we'll start with you. What is your experience? Have you had a lot of comments regarding, like it's kind of like, and Emily, I know you can relate to this, like have you ran Boston before, right? Like that's always
Yeah.
the standard of if you're a runner or not. So
Hmm.
are you breastfeeding or are you formula feeding? That seems to be the like,
Yeah.
what category do I put you in?
Right.
Even are you under 30, you over 30? We talk about age and we people kind of categorize. So talking
Really
about
weird.
feeding, like have you had any of those types of comments? And opening it up to the group too.
Yeah, and I think the worst part was actually in the hospital when I had the three lactation Nazis, all three of them at me. And like I had so many hands grabbing at my chest and pushing my baby's head. And I
Oh,
finally
wow.
lost it. And I was like, I need you guys to leave. Like, you're not helping me and you're just making me feel bad.
Wow.
Um, but I'm definitely a hybrid. We lost too much needed time, I think, in between. So, just getting not only my supply caught up, but him to
Right.
latch and like he will for a short period of time, but it's not, I would not ever be able to categorize myself as an exclusive breastfeeder or, what do they call them? EP-er. I'm
Sure.
hybrid. I'm a hybrid. So I'm doing
Wow.
my best. That's all I can do. I've had to let myself
Yeah.
forgive myself for that because there's obviously nothing that I can do more. So,
Wow. Well, you
You know
sound
what's
busy.
like I said, it's all about feeding a human and my boobs.
Right.
That's
Yeah,
all we do. And
exactly. Oh
diapers.
my gosh, girl. Oh, yeah. Sorry, Tracy, go ahead.
Yeah, sorry.
no I'm thinking what's funny about that, because I think we talked about it last time, that me not being able to breastfeed was like a huge thing for me, but like
Yes.
I still had the anxiety because when you asked her like, are you exclusively breastfeeding, because that is a question, I'm like, oh my god, like it gave me anxiety. Like, are you going to say like,
Mm,
oh, I'm an exclusive breastfeeder and like my baby's in organic cotton and like all of the things that I did? Like, I was just like, oh my God, like, is she going to judge me, when this topic comes up? And yeah, I didn't realize that's a question that we get asked a lot. And I didn't realize that it was so anxiety producing for me, but it is.
because it's probably something you didn't think you had to think about until you had to think about it.
No,
And you didn't think you had to over explain it like I just
Right.
did.
well, right. I mean, we
Well,
should explain how our baby's being fed. If they're alive at the end of the day and they're getting the nutrients that they need, I mean, like the back of the formula bottles, like I said last time, say breast is best. Well, I mean, like I'll keep it clean, but I looked at that in the store and burst into tears. Like, don't say that to somebody. That's mean. So my
that's
anxiety folks
crazy.
understand that my struggles. I don't know why, but it makes me feel better.
I'm curious,
So,
in the
yeah.
hospital.
Oh, sorry.
I'm just curious. So it's so interesting. So my daughter, my first, had they officially eventually called it like a lip and tongue restriction, but that was like 2
Mm,
months in. Like I went through the struggles for like 2 months of like the latching issues. I had the same thing in the hospital, and I was a first time mom, so I didn't know, like, consultant after consultant, and no one ever really said anything. And so I just like plowed through 2 months of like really brutal breastfeeding. And to your point, Tracy, I was like, I'm doing this. Like, I like, this is what I have to do. I have to breastfeed. And like looking back, I'm like, I really should have just like pumped, or should it was so hard.
Oh.
But did the consultants in the hospital like say he has a tongue tie, or were they like, we don't really know what's going on? Like, I'm just curious because no one ever really said that to me.
Yeah, the second lactation specialist basically looked at him and she's like, he's got tongue tie. And
Yeah.
I had a tongue tie like that I literally just had fixed 2 years ago.
Okay.
So I had it in my mind to ask about, but yeah, she looked at him from 2 feet away, down at him, and
I know. That was the hardest part. Like I said, I worked there for 2 months, and finally I went in to see another lactation consultant. She was like, go and see this, pediatric ENT. And he's like, well, at this point, you've really worked through all of whatever that is. She's gaining weight, she's nursing, she's whatever. But so we ended up just like leaving it and figured down the road if she has any sort of eating or mouth or issues, we can address it then. But like looking back, so it's funny when I went and had my son, that was like the first thing I asked the lactation consultant. She came in, I said, look at his mouth. Is he okay? I was so worried, and it ended up being, it was fine. It was night and day difference, but I think that's something that's really tricky nowadays. We don't really know, and some people do things and some people don't, and yeah, it's interesting.
Very, very. Tracy, I don't remember what was your experience when we were talking about sort of the birthing experience. What was your experience?
Well, I'm like, I consider myself lucky because I think we also talked about it last time was a C-section, and I had like people
Okay.
say like you didn't really birth a baby if you had a C-section. I'm like, Lord.
Good grief.
But because I have epilepsy, I had a planned C-section. So since I'm such a
Okay.
planner by nature, I thought it was fantastic. Now she came a week early because
Mhm.
so concerned that I would go into labor.
Mhm.
But and it was funny.
Oh, mhm.
We picked the date, which was a Monday morning, and I had to be there at like 4:30 a.m. And I asked her, I'm like, oh, can we do it later? And she was like, no, we can't. Like, because I'm not like, could we maybe schedule this for like 8 or 8:30? She was like, nope, you'll be here at 4:30. And yeah, so it gave me like a chance to prep. Like, I know this is crazy, this is really funny, but I waxed before because otherwise they'll shave you with a single blade bit. And so I got
Oh,
there,
sure.
the nurse was like, oh, I'm so glad, like she's like, people don't usually do this. And I'm like, well, I planned, I knew how, we were getting to the hospital, the bag was packed. I was just really lucky. And the C-section, I don't know anything different recovery wise, and you just do it. But she didn't latch either, and I had the same thing. And it's my body. It's that I have flat nipples, so she couldn't latch. I felt like a failure. They put shields on me. It was a catastrophe, and it was a huge contributing factor to the postpartum depression. So once I started formula, all was right in the world. Not all, but it's much better.
So does that mean, forgive me, because I don't know these things. So does that mean so were you not able to pump then?
I could, but also I had a breast reduction. So I was getting about half of so there would be no way I could ever exclusively breastfeed. And again, that leads to another thing like, well, for my vanity or whatever you want to say the reason is, I had a breast reduction. Now I can't provide for my child. So I'm kind of a jerk. But I overthink everything. So you know me well enough.
I do.
So I did pump. And I did attempt to breastfeed her. We worked on it. For 3 months. I was at that point satisfied that she got, my first 3 months of milk, whatever she could take. And you know what? I did my best.
Good.
To survive. She's a great little girl, and you do what you can.
Because I always think about, and that's wonderful that you were still able to do what you could do. I think that's great, actually. I always think about for women, if they can't, like the pain. Like I would just think, does that hurt? I mean, that's what I, think about, like what you're living with then if you can't,
Yeah, I don't know, but as a nurse, I would think. I mean, because you're going to get engorged, but it will go away
Yeah,
like that.
sure.
But yeah,
Okay.
and that's also then a physical reminder of what you can't provide to your baby or what you're choosing not to, or whatever the circumstances are. You've then got a physical reminder.
Geez Louise. Katie, what about you? Yeah, sorry, go ahead.
That's so interesting. But I was just going to say with the whole like pumping thing, I think going into having my first child, there was all this conversation about like, here's how you breastfeed. This is breastfeeding, like bringing baby to breast, all of that. And there wasn't a lot of discussion around like pumping and that was such a big learning curve for me. Cause like I said, I went through issues with my daughter and I'm sobbing to the pediatrician because she lost like a ton of weight within 2 days and it was brutal. And I basically ended up like triple feeding. So it's brutal, but like you bring baby to breast, you feed them, and then after you're done, you hand them off and you pump for 20 minutes and then you like bottle feed. And it's just like all time consuming. And I did that for a couple days to kind of get back, on track. And I think I learned a lot about that pumping. I'm like, I wish someone would have told me that like this is an option. I could have done this instead. So I had to do that to like kind of get my supply going. But the tricky part with that is that it like puts you into an oversupply. So then with my daughter, super like kind of Tracy said, like engorged and you're dealing with that. And
wow.
But then eventually I could back off. So I nursed my daughter, and then I pumped her, I went back to work, and then I was off in the summer. But then I ended up getting pregnant when my daughter was 7 months. And I noticed my supply at work just like tanked.
Wow.
And I was pumping at work and I'm like, wow, I'm like getting half of what I usually did. Okay, like
Interesting.
maybe I was like, I don't know what's going on. Took a pregnancy test, negative. I'm like, oh, well, we'll just pull from the freezer. It's gonna be fine. Went into like another week, same thing. At the end of that week, I took a pregnancy test. It was positive, and I'm like, oh, that explains that. So I tried pumping and nursing still for a while, and I probably made it. She was about 9 months, like fully, exclusively, like I pumped at that point because she was like not patient enough to wait. But made about 9 months, and then I started combo feeding with like my freezer stash and whatever I could pump and mixing in formula. And that was really hard for me because I'm going to do this. I'm committed. And, I had a great supply before I got pregnant. So it was that guilt too. I felt like so guilty. It was my fault. I got pregnant and now I'm like not doing that for my, so going through that was a really hard transition. Like I felt her because I made that decision.
Yeah.
Like,
Right.
And finally, I'll never forget, it was like, I think she was about 10 or 11 months and I was pumping and getting like an ounce. And I went into my doctor and she's like, I think it's time for you to just like focus on your next baby. So that was tough. So she made it a long time. But then with my son, again, like world of difference. It was so interesting. Like latch, totally fine. Emily, I giggled when you talked about your son gaining all this weight because literally my son left the hospital 48 hours, like the same as his birth weight. Like
we were too.
polar difference. Like latching was no problem. It was just so interesting. I'm like, this is why people say, oh, it's great. Because with my daughter, it was not. It was so hard. So with him, so different, like so interesting, no oversupply. It's been so smooth, and we made it like 13 months. He just turned 13 months. And this week I giggled. I was going to tell Annie this. I was only nursing him at bedtime. He has like full teeth, right? You guys, like scary. He just like clamped and like raked his teeth on me. And I pulled him off. I said, no. And he laughed. And I said, all done.
Done.
All done. So again,
End of the show.
13 months. I was like so proud. I'm like, I still have some freezer stuff. So again,
Wow.
different experiences. Yeah, I don't know. It's fascinating. Kid to kid.
That is so fast. And you have two, right? You don't have three?
I have two. Yep. I know.
Okay.
So my daughter's 2.5. My son is 1.
Wow. Yeah. So what were your experiences for the birthing experience? Did you have yeah.
Super interesting too. So my daughter, my water broke at home, middle of the night, like 1 a.m. Like no contractions. It was so interesting. I called. They're like, yeah, just come in within a couple hours. Okay. Showed up at the hospital. I was only dilated like maybe a centimeter or two. It was pretty having really low, mild contractions, got checked in, this and that, but then like contractions picked up like crazy. And I think by like 11 a.m., I was like, I will take an epidural. They looked at me and they checked me like 3 or 4 centimeters. I'm like, no,
Mm.
not doing this, I was contracting every minute, couldn't even put my hand
Oh,
so much. And I was like, it's time. And just like relaxed all day. My first birth was really calm and just, they came in at 5 p.m. They're like, you're 10 centimeters. Like, great. She goes, well, if you want to just hang out and baby can, move down, I got to go do a C-section. Emily, she's like, I have to do an emergency C-section. Everything looks good. I can come back in a little bit and maybe it'll be easier. I'm like, okay. She came back at 6:30. I pushed for 20 minutes. My daughter came out and boom, done. It was like,
oh.
so, okay, great. My son was 10 days past it. He did not want to come out. And I didn't really want to be induced, but my doctor's like, we're really pushing the envelope here. Like it's your baby is very large. So he was born almost
Oh.
almost 9 pounds, and which isn't too big, but I was induced and kind of was hoping like things would get going. And I scheduled for the day my doctor was on shift because I was like, I really want her there if I'm doing an induction. And she came on at like 5 p.m. and she's like, we're not really getting anywhere. I think it's time we break your water. And so she broke my water and that got things moving. Got an epidural at 7 p.m. and it didn't work on like half my body.
Oh,
I'm like lifting my leg and I'm looking at the anesthesiologist. I'm like, this
so
isn't
weird.
working. I've already done this and this is not working.
Oh, wow. Yeah.
Side and kind of that's a whole other conversation, kind of brushed it off. And I'm like, no, I've done this. I'm not supposed to be feeling everything. And in the end, my epidural really didn't end up working. My doctor,
Wow.
you can choose to just like keep rocking and rolling. You're getting close. And I think it was hard because I wasn't prepared. Now, as I've learned
Oh.
about like, natural birth or physiological or whatever, I'm like, okay, if I had known a lot more, I think I would have been a little bit more prepared for it not. But I ended up, having my son that night, like really no meds, not working. He like shot out in 12 minutes. It was wild. So I didn't feel as prepared for like a natural birth that second time around without an epidural. I was kind of like, oh, this will be great, super smooth, really easy. And it was really hard. It was really hard.
Wow.
So yeah, very interesting.
And I mean, how is a 12-minute birth? I mean, my gosh.
Well, because like I said, so the second time, the first time, they're like, okay, they're telling you when to push with an epidural. They're like, okay, you're having a contraction, push, like, okay, pause and wait. And you have the patience because you're like not feeling anything. And the second time round, I'm like, oh my gosh, I literally
Yeah.
feel this. I looked at my doctor. I'm like, can I just like push? She's like, you do you, you do you. And so she's like, you rock it out. So yeah, it was like really fast because I could feel it
Man.
all. I wasn't planning on that. So
Oh my God.
Jumping out a window.
yeah, and my first epidural, great, smooth, beautiful. Still even only 20 minutes, but my epidural didn't work. So yeah, that was so great.
Oh my God. And then it becomes
Gosh.
too late to like
Yeah.
The anesthesiologist was coming in like, I can help. I looked at him, was like, get out.
Mhm.
To do this. But on the flip side, it's interesting. My recovery physically, like, was a lot quicker and smoother with, that process. So I don't know. But yeah, very different
Good.
birth experiences, very different nursing experiences. It's
Yeah.
It's crazy how they do
Yeah.
vary.
mhm.
It's not like you've got so many years between your two kids. Like they're close. Like you have, it's not like you're, old and, all of that, like it's totally different.
Very
It's
interesting.
right. Yeah.
So, because you kind of brought up recovery, and I don't know how much we talked about this the last time too, but I mean, and now that Emily has the experience, what is that experience for everybody for recovery? I mean, Annie, I don't even think you and I talked about that too much. Maybe you did mention it a little bit to me, but yeah, how was that for everybody?
Well, I'll start.
Who wants to go?
They say you forget, and that's why you keep having more kids. I have not forgotten. I don't like how it,
I will
like,
never forget.
when he was out, it was wonderful. And then all of a sudden you're like, something's still not right. This is wrong.
Oh,
Like everything needs so much healing. And I guess
mhm.
you don't know that. Again, they don't tell you these things. And so I want to say for me, it was about 3 weeks of just you're uncomfortable, you've got things that are not where they're supposed to be, and like essentially wounds, right? Like I don't know if you guys had to have stitches or whatever. I only had to have like 2 stitches. It was something very minimal. But some people have a lot of tears and all the things and
Yeah.
like really need a lot of time. And Emily with a C-section, that's totally different type of recovery, right? Than a vaginal birth. But it was
I
not
assume
something
so.
I'm gonna forget. Like as people say, oh, you'll forget about that and have so many more kids. I'm good.
Yeah.
It
Yeah.
was I don't know. I don't need to do that again, at least at this
Mhm.
age, which I'm hoping we talk
Yeah.
about.
I think it's funny because it's not really funny, but I don't remember a lot of the recovery. I had a C-section. But what's interesting to me, coming like more from a provider standpoint, is so I had a screw put in my foot last Friday, right? I got 42 Percocet. I don't know who's going to use that many Percocets. So I know that's a lot of, but
I
I've used
mean,
I've used three. But the funny thing is to me is you birth a baby out of your vagina and you
Uh-huh.
tear parts and they're like, here's a Norco, have one.
mhm, maybe.
Right. Or out of your stomach, like even with the C-section, it's surgery. And they're like, here, there's one for you. Like have some
Tylenol. I
Tylenol.
got Tylenol.
Yeah.
I
And
got Tylenol. That
Oof.
was, yeah.
like if a man was birthing this child, he would probably be sedated for like 3 months.
Morphine drips.
Yes,
Yeah.
exactly.
You got nothing. I'm like, here's Tylenol. I'm like, that's not, it
Mhm.
hurts. But here we are.
Be back
Aw.
in 6 hours for your next Tylenol.
Like,
Good point. And I get it. If you're nursing, like I get that piece of it, but it is very interesting how meds are, there is a level of, at least, and this is maybe just my thought, please correct me. You can handle it. You
no,
chose to have a baby, so you need to handle the pain that comes with it. This was a choice, and
Mhm.
I don't know, and I don't know if you
Mhm.
guys have ever had OBs that feel this way. Like, I actually have lucked out with a really nice female OB. Um, and I hear a lot of women who prefer going to men because they feel other women are kind of like a little bit more rough and just kind of like,
Mm.
well, I'm a lady too, I can handle it, and kind of that weird,
Interesting.
you know, kind of aggressive way of dealing with patients because I'm a woman too, and you're a woman, and we should all just be able to handle this, whatever you're experiencing. So I don't know how everyone feels about that and what your experience is with that.
Well, my OB has like 3 or 4 kids of her own, and I'm same too. I'm very fortunate. She has been amazing, amazing, incredible. And it's interesting because that's with my epidural with my second. I felt like actually the male anesthesiologist totally just dismissed me. I'm like,
Mm.
no, like it
Well,
hurt.
didn't work. See
It
ya.
yeah, he really just ended up like not coming back.
Oh,
It was like it was really bad. My husband's like, do you want me to go find him? I'm like, do not.
Whoa.
But I'm like, it's not working. And I know I can handle it, but like that wasn't the plan.
yeah.
I wanted you to like fix this. And he just like really didn't. Again,
Oh,
I know sometimes they don't work. I get that. Maybe it's out of his control, but I felt like he wasn't listening.
nurturing and
It's
yeah,
even like, I'm really
empathetic.
happening to you. This wasn't part of the plan. Sometimes these things, like none of that. None of that. It wasn't even like validating, like, this is unfortunate. I'm sorry. This is the situation. None of that. Just like, okay, well, I'll come back and check on you in 15 minutes. And then just like literally never came back until,
Oh,
like I said, just don't even come back. We're just going to do this. But yes, it's
Ugh.
like ibuprofen. I remember even after I had to like ask, I'm like, it looks like on my chart, I should have had something like, oh, no wonder I'm really uncomfortable. And you see with you, I think I had like maybe 4 stitches
Mm-hmm.
both times, and even my second time I tore like in the same
Same spot.
spot. So it's just like boop, boop, done.
Mhm.
Um, but yeah, you're uncomfortable and sitting. And I think the harder part was with my second, I had a 16-month-old at home. Like she's still kind of a baby, and they say like, don't lift anything but your baby. I'm like, I got a toddler here who's screaming for me. You just like don't have a choice.
Mm-hmm.
That was the first time I felt like I could truly recover. I'm eating like overnight oats and like really nurturing myself and my body and resting. And I literally walked in the door 48 hours to like a screaming, crying other baby. And you're like, okay, I'm picking her up and we're going to bed. And it was, you don't miss a beat.
Well, and imagine not having a supportive partner, or at least Katie, I know I can speak for you. You at least have family nearby.
Yes.
And your mom is like the best grandma on the planet. It's like she's gonna help you all the time. Yeah. And Emily, I know your mom is more in the Dells area, right? So have you had support, or like like is Ed's family around, or how has that been for you?
Yeah, so I think my biggest support other than Ed, of course, is his oldest sister, who is
Mm.
almost 2 hours away, who can't get enough of the baby and is just super helpful and great. And she's like, I'm gonna take him and you go shower, you go run to the store, you do whatever you want. I was like, I
Wow.
just want to talk to an adult.
Mm-hmm, mm-hmm.
I just want to talk. Let's talk. So, she's been
Oh.
amazing and she comes like 1 or 2 times a week. My best friend Meg, she makes weekly visits too. So we've been either meeting or she comes over and same thing. Like it's just nice to like give my arms a little bit of a break.
Aw.
Yeah,
Yeah.
absolutely.
Tracy,
Yeah. How was your C-section recovery been, Emily, given that it wasn't really, because I'm
Mine
like,
is very fresh in my mind, guys.
what do you think?
So I actually have my appointment with my OB tomorrow to get cleared. So but the thing that I was most surprised by is C-section done. A couple hours later, I'm able to get up and the swelling.
Mm,
I was so swollen
mm,
everywhere in my body.
mm,
My legs were like one thigh that went all the way down to my ankles. I have
mm,
never experienced anything. That was the most painful part of my
mm,
childbirth experience. Like my
mm.
incision, yeah, it was uncomfortable. But like the swelling stuck
Mm.
with me for 2.5 weeks.
Mm.
Oh, wow.
Did they
My
give you a diuretic or anything?
no, but my main nurse while I was there, I saw her because they're on rotating shifts. I had her like the day the first like full day and then discharge day. And she was so amazing. And she like grabbed my hands and she's like, don't get on the scale. Don't do any of that. She's like, give your body a couple weeks before you don't have any expectations. She's like, and it's probably going to get worse. She's like, do whatever you
Mm,
need to do. You need to take care of yourself. You need to rest. You need to do all these things. Stay off your feet, but walk, which is a really fun. Stay off
Mm.
your feet, walk. What am I
yeah.
doing? What
And
do I
then have
do?
all this stuff going on. Yeah.
Oh, the swelling like was the worst, the absolute
Mm,
worst.
Wow.
And I never could have imagined just like to touch my foot and my leg all the way up was just like everything was bruised. It
Mm-hmm.
hurt so bad.
mm.
But yeah,
Oh.
I didn't have any infections of incisions or anything like that. Everything's been pretty smooth there. I'm still very numb.
Mm-hmm.
So
Mm.
I have my second toe on my left foot is still numb. I think that's like an epidural
Oh.
I
thing.
had
So
I
I don't know
had
if that'll
carpal
ever go
tunnel,
away.
so
Oh,
my hands were
Mm,
numb for
oh,
2 months after get like I so it was really
mm.
challenging. You talk about
you're
picking up your
right.
baby and all of that.
Yeah.
So I know that numb feeling. You're lucky
It's
it's at
weird.
least in toes because it
Hmm.
was really challenging to like you want to hold him and touch, but like you couldn't feel anything.
Yeah. Wow.
Eventually came back. I want to say about 2 months postpartum, but it was yeah, it's weird to have that numbness.
Yeah.
100%.
Yeah.
It's super weird.
Hmm.
But I'm glad the edema is gone for you, all of that swelling and
It was like a 3-day progression of like, oh, I can see I can kind of see a bone in my ankle. And then all of a sudden,
Mm,
like the third day, I had veins in my feet again, and I felt like a new
mm,
woman.
Yeah. Good.
mm. Wow. Tracy, did you have a lot of swelling? And then I also want to talk about the support thing too that everybody else was talking about.
I don't remember. Like, I really don't remember a lot of the recovery. I don't know why. I
That's
also,
great though.
yeah, I
Hmm.
had the opportunity to plan it and know what I was coming out of the hospital with and, have my stuff ready. And, where some people with an emergency C-section don't have that. So
Yeah.
remember it.
Hmm. Yeah. And what did you have with support at that time?
Well, we're military, so none. None family wise. My dad came up the day she was born,
Hmm.
and to see her. And I think they left the day after, I think.
Oh,
Um,
wow.
yeah. I remember them taking John out to dinner and leaving me with the baby, leaving me with London that night.
Oh,
And
wow.
I was kind of like devastated. It was the
Yeah.
first time I was isolated. I didn't know what to do with her. I mean, I was like 8 hours.
Oh.
So, but anyway, coming home, I mean, the military is like they're supportive. I mean, we had a meal train, people brought us food, but I mean, nothing really. It was just kind of the two of us. And at that time, paternity leave for the military was only a couple of weeks. Now I think it's 12 weeks.
Mm.
So what we did is because in the military, your time off includes weekends. I came home on a
Mm.
Thursday. We had him go back to work on Friday so we wouldn't lose that weekend. So I was home by myself for the first day, like by myself. And I was like, I don't know what to do with her. Like my milk's not coming in. She's crying. I'm crying. We're all crying.
Mm.
And yeah, so, but I think, I mean, our family. I think I probably could have
Mhm.
called people, but I set it up so I would have that time bonding with her because my mom can be kind of overbearing.
Mhm.
And, um, I just didn't want her. I wanted it to be our time. And then when it was our time, I was kind of like, hey, where's the help?
Mhm. Mhm.
So that
Yeah.
was,
Does anyone
Yeah.
feel like when you talk about support, and Tracy, you just kind of made me think of this too, and you want your time with your infant or toddler or whatever, and support is great, but do you ever feel like it can become overbearing and um where maybe your support doesn't catch the cues or doesn't know like how to help you, or and like Emily, you said you just want to have
Mm.
an adult conversation, or you just need someone to do the
Mhm.
dishes, or stuff like that
Yeah.
versus playing with the baby
I'm in
or
my house,
what
but
have
don't
you.
look at anything.
Yeah.
Yeah.
Exactly.
I remember, I don't know if you were with us, Nicole, when we went to
Mhm.
Colorado for Rachel's wedding. And
Yeah.
I had London, I had my daughter with me. We came from the airport and it was like Big Fat Greek Wedding. I don't know if you've ever seen that movie, but like the entire family
Yeah.
rushed out of the house. It was like insane.
Yeah.
Rushed out of the house, got into the van, took my baby from me, took her into the house, and then left us sitting in the car. It's like, all right. But it wasn't the emotional thing, but it's like, oh my God, my baby. But like, yeah, that's touched on what you said is like they want to do the baby stuff, the fun stuff. And it's like, hey, want to come and do my dishes? Because really that's all I need. I
That's
just,
what I need. Yeah. Well, I think it becomes challenging too. And Katie and Tracy, you guys have older kids, right? But as you hit that toddler age where you're out of baby, people want to be like, oh, here's ice cream and here's juice and here's McDonald's. Do you guys, I mean, do you worry about those? Like, that's where I think people get a little like, no, that's not our deal. We feed this way and we feed that way. And like, and I'm not trying to say juice and ice cream and McDonald's are bad, but more so like as moms, I think we have it in our brains of what is appropriate, age appropriate, or just health wise or whatever. Do you guys have those experiences? Katie, you're smiling, so I'm gonna guess you too.
Okay. So Annie hit the nail on the head. We have we are so lucky. We have so much support. So we actually moved a little over right before we had our son. Literally, we lived 10 minutes between my parents and my in-laws. And
Oh,
we
wow.
always say we could not do it without our village. Like it is incredible. Like my mother-in-law takes our kids one day a week, and my mom comes down and has our kids one day a week, and then daycare a couple days. Um, and so I think what's hard to that my husband and I talk about this all the time is they're providing like childcare. So how much can we control the other factors, right? Like, okay, you're coming and providing this. So like, what boundaries can I and can I not set? And really like let go of some things. And I think as my daughter gets older, I'm okay with like, things in moderation. I'm like, it's one day or it's okay. Or like, we had a little party over the weekend. Okay, she could have a couple juice boxes. It's not the end of the world. Like, I have to let go a little bit. And I think, when they're under one and you're a little bit more worried about like nutrition and how are they getting enough blank, blank, that's where I felt I could say a little bit more. And I think as I had my second, I felt like I was like, you know what? I can set these boundaries. And I feel more confident doing that. With your first, you're like, I don't know. Is it okay? Is it not okay? But I think, yes, it's tough to do things. My thing now is more like a safety thing. So like foods that are choking hazards, it's really easy to say like, that's a choking hazard. I just would appreciate them not having that. Stuff like that makes it easy. Or like, yeah, just stuff like that. But it's hard. We're running into that where they provide childcare. So how much can I restrict what they're doing?
Right. What they're watching on TV or like,
Yes.
let's, like, what are we doing outside? Can we playing with sticks? Like, just whatever, like.
Totally. Yep.
That's tough.
We get so much support that it's a give and take. And as I've gotten older, it's easier when they get older and you can say everything in moderation it's okay.
Right.
But it's okay to set boundaries too. And I feel more confident with my second, and just as I get a little bit more seasoned as a mom, to say we prefer blank. This is what we're comfortable with, and it's okay to say that, but it's hard too. It still is really hard.
Tracy, what about you?
Yeah.
Oh, I'm sorry, Annie.
No, go ahead, Tracy.
I'm kind of like, I think society, like, it's like, oh, grandma, like they even have those shirts, like, I'll just ask grandma or whatever.
Yes.
I've found that like my mom does that, and I've had her almost undermine me. Like she has chocolate by her bed. London's brushed her teeth, and she'll like, I have a secret treat for you or whatever. And I don't mind, like my neighbor does it too. She's like, she'll feed London a cookie, ice cream, and a waffle cone for dinner. And I'm like, but you're doing me a favor. So I can't really say like, hey, you're watching my kid. Can you please throttle back? I mean, I guess I could, but I don't have a problem with that as much because London knows like this is not a normal thing. This is not a good thing. It's the sneakiness I don't like. And I've talked to my mom about it. I don't like sneaky. Like if you're going to give her a treat, I don't want her to think that she has to lie or sneak it from me, because then we've got a bigger problem. So, my mom also has some vascular dementia though. So it's a tough road, but that's the thing I don't like. Yeah, I really don't want her to have cookies and ice cream for dinner. If it's once in a while, that's okay. But then you have that guilt, like you were saying, like, well, you're watching my baby you're doing me a favor. I'm gonna say she has to eat like, kale. And so,
or at least some sort of ensemblance of a meal, and then the
Of a normal meal. Yeah, right.
Even if that meal is a piece of pizza, at least we're getting some substance,
some nutrition.
Right?
Yeah.
Right. Some kid-friendly thing going on. Because again, we talk about like how do kids become picky as adults? Well, if we keep feeding them the same couple things and we're not, like throwing kale in front of them to try and to, learn those textures, and they just eat ice cream and pasta every day. Well, things can develop later on, and that becomes really challenging because grandmas, aunts, whomever, they want to spoil these kids. And I get that, but also like, a child consuming a scoop even of, let's say, just throwing this out there, Culver's yogurt, like ice cream, like that's a big amount of grams to shove into a really, really little body. Even though they can eat it, they can consume it, and it doesn't, like, it's not a fullness factor. It's a lot for their little organs to process. So when we think about them having ice cream or something like that, like it's a very little amount to kind of check box that the amount that they, technically need, if you will. So it's very interesting, and you wonder how much of that impacts later on, as we make food choices as adults, right? You talk about the sneakiness, like what does that teach? Stuff like that,
cookies and
Right, exactly.
Right.
You know, so it's very, very interesting. And before we have to sound off, I really want to bring up the topic of because I have a friend who they've been doing IVF for a long, long time. Both of them
Mm.
are in their 40s. And now the question is, now they're finally able, you know, they finally are about 4 weeks pregnant. So, you know, getting there and hopefully it sticks, but they're older. And this concept of being older as having kids, I thought was a normalized thing. You know, especially as you look at Hollywood and it's, George Clooney had kids when he was like 60, you know, so like you think it's normal, but there's still a lot of commentary around age.
Mhm.
And even I feel like as kids get to school age, which would be you, Tracy, and Katie, you're on your way there, this judgment around, oh, that's the silver fox over there, or, like for certain dads that are older, or moms who are older and they have, let's say, a first grader, and the assumption is, well, you must have like an eighth grade, like more kids than that. Does anyone felt any commentary or, any issues around age as they've become parents or have been parents, anything around that?
I have because I'm a lot older than, I mean, I could technically be her granddaughter or grandmother. I mean, if I
Mhm.
had her really young, I didn't have her until I think I was 38. And I mean, so I'm a lot older than the moms, but you know what? I've still formed a really strong bond with a lot of the moms.
Mhm.
And if anybody talks to me about it, I just tell them it's nothing I regret. I wish I had a little bit more energy now, but I used those first 38 years to do what I wanted to do. I didn't say I'm going to have all my kids and then we're going to celebrate our golden years. My golden years were in my 30s when I could
Mm.
travel, when I did the fun things, when I wanted to build my career, and I don't regret it.
Mhm.
And I
That's
tell
great.
people that. So
Mhm.
if you don't like it,
That's awesome.
didn't have the
Mhm.
baby.
Don't, yeah. Yep.
I think
Yeah,
it's
I had oh, sorry. Go ahead.
I was just gonna say medically, I think what is it, 35? When they say like, oh,
Oh
you're
yeah. Yes.
geriatric. I'm like,
That
Yeah.
It's ridiculous.
what, 31, 32, boom, boom. But as we think maybe down the road, if we want more, I'm like, well, it stinks to think like, okay, well, I probably should have another before I turn 35, so I'm geriatric. I'm like, that's hard. That just that I don't want to say diagnosis, I don't know, that terminology of, well, you're old, so you can't have another kid. I'm like, but I'm really young.
Mm-hmm.
Hmm.
Yeah,
Hmm.
especially because you feel so young too, regardless of the number. Even in your
Hmm.
40s, you're like, old? Wait a second. Like I'm still doing the
Hmm.
same thing, like it's really interesting to have that geriatric phrasing. Emily, I know
Annie,
you
you
have
were
an
kind of telling my story through this friend of yours.
Oh, really?
Um,
Okay.
I'm 42.
Yeah.
I went through IVF to get my little guy. Um, every single issue on my chart for every single appointment I had was AMA, advanced maternal age. They don't put geriatric, thankfully,
Yeah,
on
they
the
changed
medical
it.
charts, but that was my number one, like on the issue list above IVF. So,
Hmm.
it's I haven't really had too many comments. I guess I'm kind of lucky when they're like, "You're 42?" I'm
Oh,
like,
okay. Yeah. Yeah. More in a
um,
Yeah.
positive way. Yeah, like
yeah,
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 yeah.
yeah.
That's good.
So
That's
that
good.
at least has been helpful. But yeah, the struggle was real to get to where I'm at. And like we did IVF for a couple of years before, well, we had one. He's our only one. So he's my little miracle. And it's if your friend needs anyone to talk to, send them my way. I have no idea
Well,
who it
and it's
is, but
funny,
like
I just got a
I
text like, do you have any books about an older dad? And I'm like, no. Like,
No.
no. I'm like, I didn't read anything. I just kind of went into this. But there are really good, I used online sources and went to different, like, they did, I think probably since the pandemic, they transitioned to a lot of like Zoom education. And so that's what I did, a couple of those that I thought would be, kind of pinpointed different topics. So I get it that way. But he's really concerned about being an older dad, and maybe dads experience the age thing more than moms. I know for me, Brian had
Mhm.
some serious issues with being older and on number two and 17 years apart.
One out of the house and
Yep.
one,
One's
yeah,
literally
one
leaving and one just entered.
Yeah.
just entered. Yeah.
So he, that was a big struggle for him. And again, that thought of like, I'm so old. And I'm like, you're not old. Like,
Mhm.
you shouldn't feel that way. So there was a lot around that. And so I don't know if there's a difference if you guys have experienced that with your partners of being older, having that criticism around age too. Maybe it's a boy thing more so. I'd be
Yeah.
curious.
He gets more flack from his friends, like, you're starting over, man.
Yeah.
Ugh.
Yeah.
I'm like,
Guys are assholes.
so
I
like,
know.
what does that doesn't make any sense to me, but
Yeah.
Continuing, like you're just
yeah. Yeah.
right. Yeah.
Husband is younger than me. And so I'm just,
Oh,
he had 2 kids before 30, and I had our 2 kids after 30. And so that's been like a fun,
yeah, that's fun then. Yeah.
yeah. I'm like, okay, well,
You're old then. You're the old one.
compared to him, I'm like, you just turned 30, you're so lucky.
hmm What it would be
I
like to
have
be 30 again.
yeah. I have a really good girlfriend who they did the IVF thing too, but she had her babies at 48 and 49. And they are an incredible family. And I just, it's so fun to watch them and watch the kids grow. And I think that I just find that it's really lovely because, the two of them are extremely established in their careers. And also at that age too, you have so much more wisdom and you have a different amount of patience. You're just more settled in your whole being. And it's lovely to see how that's coming across as they parent. So anyway, we do need to wrap this up. And I just thought I would ask everybody too, like, again, we were kind of talking about like words of advice for anybody out there. We've talked about none of the subjects we were going to talk about, but this was so much more interesting, actually.
I know. That's
But
usually how it
Emily,
works.
because really, but it's wonderful. I love it. I love how that works. But Emily, because you didn't have a chance to like talk about words of wisdom to any new moms out there, what would you actually say after you've been through it?
Well, I know the thing that everyone kind of said was sleep when the baby sleeps, but the carpet's not going to vacuum itself. The dishes aren't going to do themselves. Like,
Yeah.
you find that second gear, that second wind, like you find it and it's there and you'll sleep sometimes and like, and you'll be okay. I think that I put a lot of pressure on myself of like, oh, baby's sleeping, but, and I was really just torn so much and still kind of am. But I mean, you find it and it's fine. Everything's fine. And sometimes the dishes get left and that's also fine.
Yeah.
I've just been
Tracy,
focusing
I
on
know
my little guy.
that's awesome. And Tracy, I know you got a scoop, but is there anything that you want to say before you dash?
I don't know. I mean, I don't know. I just that everything's normal. I mean, there's no normal in parenting, in raising a baby,
True
in
enough.
anything. And I think that it's just important to put judgment aside, about breastfeeding. I mean, even you, I'm sure that people ask you if you guys have kids or are going to have kids. It's
Mm-hmm.
not really anybody's business what you do, and
Mm-hmm. Mm-hmm.
just being mindful of the questions that you ask and that you don't know what people's struggles are. And there's that famous meme that everybody's like struggling with something, right? But you don't know if, breastfeeding was a struggle. So like just be cautious with everything. There's just no right way to raise a child at all.
Yeah.
And Tracy,
Yeah.
if you
Yeah.
are going to question it, be mindful of your tone.
Yes.
Yeah.
Because tone is what causes that's the judgment.
Right.
True
It's
enough.
okay to be curious, but it's also, we have to do it in a neutral way too.
Exactly.
Yeah.
Presentation.
Mm-hmm.
Exactly.
Yeah. Thank you for that, Tracy. Katie, how about you?
I don't know if I have any other words of wisdom. I mean, I think Emily hit the nail on the head. Like, you do it. You just do it. People ask me
Yeah.
that having like 2 very small kids, like, oh, wow, like, you must be so tired. Do you do this or how do you get it through it? And you just do it.
It just happens.
I think too, you have to remember like vanity needs to be set aside and like you're focused on this little individual maintaining your home and it doesn't have to be about our body. We are just trying to get through it and be happy
Yeah,
and take care of this little being because that's what's important,
right, right.
I think people forget
Exactly.
about that it's about the baby, like
Mhm.
it's about the kids,
I appreciate
Yeah.
that. And how are you doing? That's kind of nice
Mhm.
too,
Yeah.
to not be completely
Yeah.
forgotten.
Yeah. What do you need? That's-
Right.
Wow, let me tell
Right.
you.
Do something for you.
Yeah,
Yes,
exactly.
that fills my cup.
Well, this is great, everybody. Thanks so much again for coming
Yeah.
back on and sharing all these experiences. And I love it. Super fun. So, and congratulations again, Emily. And keep on keeping on there. And
It was so nice to see all you guys again.
Thank you.
Nice to see you
thanks
guys.
again,
Yeah,
everybody.
thank you guys. We appreciate it.
Yes.
Bye.